session. Initially, I'm going to be giving a introduction about this lens, rather a review of literature that's available.
Thank you very much, Dr. Ramamurthy. As you all know, he's been the past chairman scientific committee and past president of AIOS, runs a great eye foundation and really one of the giants in ophthalmology in India and overseas. Dr. Ram.
Thank you so much, Mahipal. My topic is elevating cataract surgery standard of care with a game-changing intraocular lens. This is going to be a very short literature review. No financial disclosures relevant to this presentation. Though we keep talking about multifocal, trifocal, what lens you will have in your eye, toric lenses, etc., one lens that has remained constant is the monofocal intraocular lenses. And very little has happened as far as the advancement of these lenses is concerned in the few years. In 1995, from PMA, we got the foldable lenses, asphericity in the year 2001. The haptic design, we went on to the single-piece lenses. The yellow pigment with doubtful advantages was introduced. PCO prevention by square modification of the edge of the lens came into being. But then I think the incremental benefit was really introduced by the enhanced monofocal concept, which the IHANS brought in. And this was a paradigm shift as far as monofocal lenses are concerned. This is, of course, built on the time-tested millions of lenses that have been implanted more than 2 decades of the Technis platform. And when you are talking about the IHANS, it's not the near vision that we are talking about, but it's the intermediate vision that's of concern. It essentially gives you good distance vision without any drop in quality, good intermediate vision, and then functional near vision. So, and once you get this, a 60 or a 70-year-old is almost able to do most of their activities, day-to-day activities, without having to rely on glasses. We always tell these patients that if you want to do significant amount of reading, you would require readers, and we are not even doing much of monovision these lenses. And once you set these expectations right, it seems to work well. I think it's been said that the imitation is the sincerest form of flattery, and just the number of monofocal plus lenses that have become available in the market, just because the other part of the industry also felt this is a good way to go, is that's the reason you have a flurry of monofocal plus lenses, and obviously it's a good thing to have. And I'm going to just very briefly review the literature, just about 3 or 4 slides. Basically, it's a holistic view of all the published literature on the Technis IHANS and other enhanced monofocal, with the objective to empower our evidence-based adoption. Almost, I'm sure everyone in this hall is using IHANS and has some experience with this. But is that the right way to follow? The search date was on 4th of November 2024. The search platform was on PubMed and Embase, and IHANS and other monofocal plus lenses were essentially used for the search. And the conference and podium abstracts were excluded from this particular research. As you all know, that systematic review and meta-analysis and the randomized control trials have the greatest evidence, while on the hierarchy of evidence, expert opinion has the least. All this was taken into consideration, and what you see over here is that the Technis IHANS has the largest body of evidence regardless of study design or evidence level. The number of as far as the literature evidence is concerned, the number of published peer-reviewed published papers is almost double of what has been published, all the other lenses, the monofocal plus lenses put together. And the level 1A evidence is systematic review and meta-analysis. There are 3 published papers. Level 1B, that's randomized control trials, is 10 published papers. And out of the 51 IHANS studies, 48 focus on intermediate vision and demonstrate a significant amount in 98% of these studies. That's essentially the selling point or the claim of this lens, that it's a good intermediate vision, and that it truly seems to function that way. And another important aspect is that when it's compared with any monofocal lens, irrespective, not just the Technis one, but any monofocal lens, that there is a consistent result in the improved intermediate vision, regardless of the conventional monofocal lens that is checked with. These two slides are the representative of all the monofocal lenses that have been checked. It has been compared with. And how does it line up when you compare it with other monofocal plus lenses? Even though as far as the performance and improvement in the intermediate visual acuity is concerned, they may be performing similarly. There was a demonstrable superior quality of vision as far as in terms of the contrast sensitivity. So essentially, and this is just in case you are interested, this is all the literature that you can go through on these monofocal plus lenses. So POC is something that we are just gaining experience, at least in India. But as far as iHands is concerned, it has a significant history, and all of us have adapted to us. In the next couple of speakers, based on the evidence that I presented to you before, they are going to talk to us about this.